Hey guys, Dr. Ray Marque here, your local chiropractor at Back Pain Relief Center. And this is our Tuesday edition of Dr. Ray TV. So today we're going to talk a little bit about chronic reoccurring low back pain that doesn't respond to traditional treatment or care. And we're seeing it more and more. A lot of people have this back pain that just comes and goes and comes and goes. And some people it doesn't even go, it just stays. And they just deal with it and it goes on forever, and they see a ton of different doctors and they're always chasing a way to try to feel better. And I think that's how we get into the problems of these long-term pain management patients and that whole thing that goes on there that may be difficult for people to deal with. So first off, we had to ask ourselves, why aren't you responding to care? So why is your back problem not responding when so many other people's do? Well, I think there's a few reasons. And first off, there's a lot of reasons for back pain, but the majority of people out there have some degeneration in their back. They may have some herniated discs or some osteoarthritis, and it causes a whole bunch of ongoing problems. So why does one person with all these problems, degenerated disc, herniated disc, spinal stenosis, pinched nerves, and all these things respond favorably to care, and another person doesn't respond and they can't get through the pain and they're not managed well? Well, I think there's a few factors. Number one, everyone has different pain levels, and what causes one person a lot of pain may not cause another person some pain. And even me, myself, I've seen MRI reports where one patient has a really big, huge herniated disc, another person has a tiny little bulge, and the person with the bulge is in a lot of pain, the person with the big herniated disc isn't in pain. So I think people perceive pain in different ways, and there's a lot of factors from environmental to lifestyle to genetics on how they respond to that type of pain. And I even think, on kind of a side note here, prolonged pain in itself becomes a condition on itself, and we have time for another talk on that one, and we could go on that. So pain itself can become a condition, but let's stick to just the chronic recurring low back pain that doesn't respond well. Hey Debbie, how's it going there? So anyway, let's go back to this. So why aren't people responding? Well, I believe it has a lot to do with compression of the joints. So compression of the lumbar joints, tightness of the muscles, decreased range of motion, dysfunction of the joint not working correctly, increased inflammation levels, and this chronic recurrent problem. So nothing ever just works right. And how does all that happen? Well, it happens a lot of ways, and there's a new condition I don't want to say new condition, it's a condition that I've been focusing on more and more and having good results with my patients, is repetitive stress disorder. So for whatever reason you injured your back, whether it would have been from a car accident, a slip and fall, or a degenerative process because of your genetics, something's not working right. The joints in your back aren't working, or they're calling it dysfunction. Biomechanical dysfunction, meaning they're not working the way they were supposed to. God designed this a certain way, and now it's not working. So something happened, it doesn't work. And when it doesn't work, the body still has to move around. You still got to get up. You still got to eat something. You got to go to work. You have to take care of your kids. You have to do all these things. And we force our bodies to work when they're not in the complete or correct biomechanical way that they should. Meaning we have a dysfunctional joint, we have some degeneration, and we're asking it to move day in and day out. With that repetitiveness, we start to build up scar tissue around the joint and in the muscles. Everything's tightening up. They call it adhesive formation or fibrous formation, interarticular, meaning in the joints, or intermuscular in the muscles, and it begins to tighten up, further complicating the problem. From that repetitive stress, the adhesions build up, the scar tissue build up, which makes a big snowball of a problem. So now a joint that didn't work right, and Debbie, I see you had 4 disc damages there. And if anyone watching this live thing, this is kind of a new thing for me. People can put comments, and I'm seeing them, and you're probably not seeing them unless you're writing it. So when you see me go off on this a little bit, it just means I'm responding to what someone's saying. So Debbie, maybe this has something to do, or maybe you can get something out of this. So we have a joint that didn't work right. We continue to ask it to work because we need to. It builds up adhesions in the joint and in the muscles, which tighten everything up. It further compresses the joint, and we snowball into this big problem. So what do most people do? Well, most people, I would hope, will come see me or another chiropractor and start working on the biomechanics. But a lot of people will go to their primary doctor, they may go to an orthopedic, or maybe they'll go to a pain management doctor. All great choices. I think everyone has your best interest in mind, and everyone's trying to get you better the way that they're trained to get you better. But when we go the complete medical route, unless you address the biomechanical function of the body, so the joints and the muscles, and we just do medication or some strengthening exercises, it never gets to the root of the problem, okay? Which can be very difficult at times to manage. So if they're giving you medication and they're getting injections, which I think are all appropriate, unless we work on the biomechanical part of it, it may not respond, or may just continue to be a continued chasing to get it better. Let's take it back just a quick second back to the adhesions in the scar tissue. You know, when we get adhesions or scar tissue in the muscles, what it typically feels like is I feel tight all the time. I feel like I have a lot of pressure in my back. I lost range of motion. I have difficulty putting my shoes on. It's hard for me to put my socks on. If I go to twist or turn around to reach for my back pocket, I can't get to my wallet. It hurts when I walk to the mailbox. All these things are all classic signs of adhesive formation in the joints and the muscles. And what happens is people lose range of motion very, very slowly. So you used to be able to touch your toes, and now, well, maybe I can only touch my knees, and now my leg doesn't go up quite a bit. And people from day to day don't typically put a lot of attention to it because they can still walk around, they can still do basic things, and it's not killing them, okay? The thing with back pain is it's never gonna kill you. It can make you miserable, but it won't kill you, so people don't pay attention to these signs. And it just further just snowballs into this big problem, and people don't respond. And when I say don't respond, if you're out there and you have back pain and you go to the doctors and say you do some medical treatments and you do some chiropractic or some therapy, and you go through a month or so and then you feel better, and then 2 months later it's back again and we do the same thing, it goes away, you come back and we do the same thing, that's a reoccurring non-responsive problem. Again, going back to why. Well, we're looking at compression of the joint, all right, dysfunction of the joint, decreased range of motion, and increased tenderness or tautness or tightness of the muscles. All of that needs to be addressed. So what else can you do about it? Well, a couple things. You can come see me. I'll directly work on the muscles and on the joints, and we will try to get the body to function better. But many times when patients have had this throughout the years and for an extended period of time, there's a therapy out there that I do on quite a few of my patients that we've had huge success with bringing back their biomechanical integrity of the area. And it's called manipulation under anesthesia. So manipulation under anesthesia is a procedure designed for patients that have reoccurring problems that have been unresponsive to traditional non-invasive medical and chiropractic treatments, meaning we've tried injections, we've tried radio frequency ablations, we've tried medication, we've tried physical therapy, we've tried yoga, we've tried it all, and the only thing left is to have a surgical consultation. And many times the surgeons will say, hey, you're not a candidate, or sometimes patients don't want to have the surgery. Then we consider manipulation under anesthesia. So what is manipulation under anesthesia? Well, it's a procedure that we do in a surgical setting where we're going to put you to sleep. We're going to put you under anesthesia for about 20 minutes. And it's designed to restore the biomechanical integrity of the lumbar spine, the hips, and the pelvis. And what that means is we go in there and we do a very aggressive form of myofascial release, so stretching the muscles, breaking up the adhesions in the scar tissue of the muscles. We do some joint manipulations in the pelvis, hip, and lumbar spine that will break up those adhesions and allow the joint to work better. So the goal there is to restore function of the muscles and of the joints to allow for the best biomechanical integrity or motion that your body will allow. Now, am I going to say that this is going to cure your low back pain forever? No, I'm not going to say that. But what it's going to do is take the compression off those joints. I think one of the biggest problems when it comes to our back pain is that we're so tight and it's so much compression on those joints, there's no traditional way for people to loosen it up. With this procedure, we can break up those adhesions, we can loosen things, restore range of motion, take pressure off the joint, and allow the body to work the way it's supposed to. Now, is this procedure for everybody? Absolutely not. This procedure will be done after we try to do all of it in the office with you awake and see if we can handle it and get to where we need to be. If we're not where we need to be and the pain is persisting and we're not able to get that range of motion, it is yet another option to get you back to functioning and feeling as normal as we can. Doing a manipulation under anesthesia is like doing weeks of therapy all in one day because we can do it so aggressively. Debbie, with the getting flare-ups a lot on there and having that back pain, it may be something that you want to look into, but I would want to make sure that we've tried everything else first. But just message me, Debbie, if you want to talk about it some more. All right. Where else are we here? I'm looking at my notes every time I look down. Again, manipulation under anesthesia. This isn't for everyone. It's for reoccurring low back pain that has been traditionally unresponsive to non-invasive medical and chiropractic treatments. It is an option right before the surgical setting or finding out if you need surgery. All right, so just to go over a little bit. Hey Dave, what's going on, buddy? We were talking today a little bit about chronic recurring low back pain that doesn't respond to traditional medical and chiropractic treatments. We've tried in-office stuff, didn't work or kept on coming back. We've tried the medical route, being medication, injections, things like that. Manipulation under anesthesia may be a viable option for you to help bring back as much of that biomechanical integrity as we feel possible. All right, so look, if you'd like a little more information about all of this or you'd want to talk to me about it, if you're one of my South Carolina patients, I want you to go to MurrellsInletChiropractic.com. Again, that's MurrellsInletChiropractic.com. You can get a bunch of information on it there. You can also email me. Also, everyone out there can message me on Facebook. I respond to all of them. We'll talk about it and see if I can't help you. If you're up in New Jersey, it's backpainrc.com. Again, that's backpainrc.com. Get on there. There's all kind of information about what we do, especially manipulation under anesthesia, traditional chiropractic care. Again, what else? Any other questions? Please just message me. And I hope everyone is doing well. It is Tuesday afternoon around 5:30. Have a great night. Bye-bye.